So I'll be talking about Web's most searched questions regarding breast cancer, and we'll dive right in. So the first two questions are, how common is breast cancer and how many women get breast cancer? And the answer is that it's very common. In fact, it is the most common cancer for women in the US, and it will affect about 12 to 13% of the female US population. In numbers per year, that's over 280,000 women. However, men can get breast cancer as well, and it will be affecting over 2,600 men on a yearly basis. When it comes to mortality, about 43,000 women and over 500 men will die from the disease per year. If you put that into useful numbers, that means that 1 in 8 women will get breast cancer in her lifetime. And when we look at these numbers here, which show you the chances of getting breast cancer by age. So this first column shows you your chance of getting cancer between birth to age 49. Breast is on the second line here, and it affects 1 in 49 women. So it's very rare below the age of 50. Looking at the next decade, from 50 to 59, it affects 1 in 42 women. 60 to 69, 1 in 28 women. 70 and older, 1 in 14 women will have had breast cancer. And overall, the lifetime summary, birth to death, 12.9% of the population, or 1 in 8 women. And these are the leading sites of new cancer cases and new cancer deaths. So we'll look at the female column over here on the right. The first sign is the estimated new cancer cases. And you can see here that that's about 30% of the new cancer cases are breast cancer. And when it comes to death, breast cancer is not the most common leading cause of cancer death, that is lung and bronchus cancer, but it is the second most common, with about 15% of all cancer deaths stemming by breast cancer. The next question is, what causes breast cancer? And there are a lot of reasons that we know why people get breast cancer. The two most common reasons are being older and being born female, and there's not really a lot we can do about either of those. Another big factor, which mostly impacts younger women or certain women with more aggressive breast cancers, are inherited genetic mutations. And these are changes to your genes that you can inherit from either your mom or your dad and pass on to either a son or a daughter without knowing it, that will put you at higher risk for breast cancer or other cancers as well. So some women get their breast cancer because of that, and they can find that out by getting a blood test, by looking at their family history, by talking to a provider. There are other risk factors for breast cancer, such as like radiation to the chest at an early age. The most common type of radiation that we're talking about is the so-called mantle cell radiation, and some people get those in their teens or early 20s for a treatment of lymphoma. That increases your risk for breast cancer as well. And then there are other risk factors, and even though we might think they play a major role, they actually don't, and you can tell because the font size is getting smaller. Obesity is a risk factor for breast cancer after menopause, as well as menopausal hormone therapy can cause certain type of hormone receptor positive breast cancers. Alcohol consumption in a significant amount, greater than 7 drinks a week especially, can increase your risk for breast cancer, as can physical inactivity. And then there are certain reproductive factors, such as a long menstrual history, someone who gets their period very early or their menopause very late, people who have pregnancies late in life or no pregnancies at all, people who don't breastfeed or only breastfeed for a short amount of time, and people who take hormonal contraception can be at higher risk of breast cancer. However, these risk factors usually increase breast cancer risk by only a few percentage points, if that. The biggest and most important risk factors, age and being born female, are nothing that we can really modify. This is a common question that I see a lot when people ask if stress caused their breast cancer. And the short answer is probably not. We don't really know, but it's very hard to prove that stress could cause breast cancer. I'm not sure that there's any good study that can evaluate that. The opposite, however, is true. Breast cancer does cause stress, but I don't think that the other way is necessarily a causative relation. And then this is another good question. What does breast cancer look like? And now, breast cancer is not equal to breast cancer because there are certain types of breast cancer that behave differently and that are more aggressive or less aggressive and that look and feel differently, and that that can get discovered in different ways as well. Early breast cancer or non-invasive breast cancer usually doesn't cause any signs or symptoms. The way we find these early breast cancers tends to be mammography screening or ultrasound screening, or incidentally. More advanced breast cancers can cause a lump or a mass in the breast, and some people feel those themselves. Sometimes it's the primary care physician or the GYN physician that feels them when they do the annual examinations. Sometimes it's the partner that feels them. Sometimes it's even a story of a patient getting an impact to the breast, like they're in a car accident or a dog jumps on the breast and they get a small bruise, and then all of a sudden they examine the breast and feel a lump or a mass there. Another important sign or symptom to know about are persistent changes to the breast. And these can be subtle, such as skin thickening. Some breast cancers can involve the skin and cause swelling, redness, or a skin that looks kind of like the peel of an orange. We call that orange peel skin. Breast swelling to the point where the two breasts all of a sudden aren't symmetric anymore can be a sign of breast cancer. And I mentioned skin redness. This can be a sign of breast cancer, but often it is also a sign of mastitis or breast infection. So differentiating that is really difficult, and that's one of the reasons to look up a breast specialist or talk to your primary care physician first. Other signs of breast cancers are nipple abnormalities, such as spontaneous discharge, especially when it's bloody, or coming only from one duct, or coming only from one side, scaliness, skin that looks dry and flaky, especially around the nipple, or retraction, which is drawing back within itself. This retraction can happen anywhere on the breast. It comes from breast cancer pulling on the ligamentous attachments between the breast and the skin, and that is a sign to watch out for. When we talk about nipple discharge, the one that we induce ourselves doesn't really count because a lot of people can do that even when they stop breastfeeding or they're not breastfeeding anymore. The induced nipple discharge is not as concerning as the one that's spontaneous. This is a little infographic that summarizes the symptoms of breast cancer. So up here on the top left, you can see nipple discharge. That's fluid coming from the nipple, and it can be any color. It can be white and milky. It can be bloody. It can be yellow. It can be green or even brown. The most concerning ones for sure are the bloody ones. There can be lumping or thickening of the skin, and this can be very subtle and really difficult to feel, especially when you have dense or breasts that are lumpy in nature. A visible lump can sometimes be noted, especially when you move your arms, raise them over your head, bring your shoulder forwards and backwards. This can sometimes show a mass that's sitting under the skin and make it more apparent. Skin dimpling means a little bit of retraction on the skin or the nipple, like I said, because of the cancer pulling on the ligamentous attachments between the breast and the skin itself. And this is the pulled nipple on the next graphic over. And then skin irritation can be a sign of breast cancer, especially if it persists. Armpit pain can sometimes be a cause. This often comes from cancer having spread to the lymph nodes or a really high cancer that's sitting in the axillary tail of the breast and the upper outermost part of it. And that can irritate the nerves that sit in the armpit, which can cause pain. And there can be a change to the skin texture, like I said, thickening, redness, an orange peel type, sometimes even bruising. Where are most breast cancer lumps found? So they can be anywhere in the breast. The ones that we feel ourselves or that our doctors feel tend to be more superficial because they are easier to feel. The deep ones, the ones that sit right in front of the pectoralis muscle or hide very deep below the nipple, usually only show up on imaging. Those can be really hard to detect. There are rumors saying that, breasts that are more on the inside, breast lumps that are more on the inside of the breast are less concerning than the ones on the outer side. That's not true. Any lump in the breast can be a cancer. Cancer can be in all the locations. And so any kind of breast lump needs to be evaluated. This one is also a really good question that a lot of people ask me about. Which foods can prevent breast cancer? And again, the answer is that we don't really know. There's a couple of things that we think might help, such as a well-balanced diet with lots of fruits and vegetables and a healthy weight, but we don't really know that one food for sure prevents the breast cancer from happening. We know that 30 minutes of exercise a day, 5 days a week, decreases breast cancer risk. And to limit alcohol and cigarettes will also likely help decrease your risk. But there is no superfood that prevents us from getting this cancer. And a lot of people ask me if breast cancer hurts. And I'm sure that a lot of people ask that question to their Google search button as well. So usually breast cancer doesn't hurt. However, sometimes it can, especially when it's larger breast cancer that is growing into the surrounding tissue. If it's growing into the muscle that's underneath the breast or the nerves, especially in the armpit, that can cause pain. If it pushes other tissue away, such as the ribs, it can cause pain. However, breast pain is really, really common. A lot of women experience it in their lifetime. It can vary with their cycle. It can be a lot of different reasons for it. Sometimes it's the muscle that spasms and causes pain. And the most common causes of breast pain are not cancer. So breast pain is not a very common symptom for cancer patients at all, but it is a very common thing to experience in our lifetime. This is also a really good question. How quickly does breast cancer grow? And how long can you have breast cancer without knowing about it? The answer to these questions, again, is that it depends. It depends on the type of breast cancer. Some of them grow really slowly. Some of them can be present for many years. We usually don't know these things well because we don't observe breast cancers, because when we see them as doctors, we like to treat them. And we don't think it's ethically reasonable to observe them and see what happens to them. But we do know that some aggressive breast cancers can grow really quickly. Sometimes patients can have negative mammogram and ultrasound, and a few months later have a large aggressive breast cancer in their breast. That's possible. Other times we get patients who have a slow growing mass that they said they've had for many years, and we see it's a cancer on the biopsy. So there's a wide range of growth and speediness of growth. And some people get it quickly and it grows quickly, and some people get it very slowly and it grows slowly. Likely the ones that grow quickly behave more aggressively. Likely the ones that grow slowly behave more slowly. But cancers can change as they grow, and their behavior can change as well. So when is it time to see my doctor about my concerns? And the answer to that is whenever you have a concern, because, like I said, breast cancer is very common. So any kind of breast concerns should always be taken seriously. Of course, a new lump or a mass that you feel that wasn't there before should be evaluated. And imaging is usually the first way to do that. Sometimes patients had an old lump or an old mass that has been biopsied and it's been benign, and people have watched it for many years, but all of a sudden it's growing again, or it's hurting, or it's causing skin changes or redness. That is also a change, and that is also something that needs to be evaluated. Skin changes to the breast should be evaluated. Not all of them are cancer, actually. Most kind of skin changes are not cancer. There's all kinds of infections that are possible. Abscesses, any kind of skin lesions, of course, can affect the breast as well. But they still need to be treated. If you have mastitis, you might benefit from antibiotics. If there is an abscess, this needs to be taken care of as well. So any kind of skin change should be evaluated. It could be that it's a dermatology issue, that it's a mole that has changed, or that it's even a skin cancer that's affecting the breast. So skin changes to the breast should be evaluated. And then breast size changes as well, especially if they happen later in life, once our breast tissue is done growing. If one breast suddenly becomes bigger than the other, that's of a concern. If one breast suddenly becomes asymmetric, that is also a concern that needs to be evaluated. And nipple discharge also. A lot of nipple discharge is benign and doesn't mean that there is a cancer. Sometimes it's ongoing milk production in a patient that stopped breastfeeding. Sometimes it's fibrocystic disease that can cause this. Sometimes it is benign masses or little lesions that can cause nipple discharge, but sometimes it's breast cancer. And so when you experience new nipple discharge, that's a reason to go see a doctor. So once you have a cancer diagnosis, how are you supposed to find the right oncologist? How do you know who you like and who to go with? And ultimately, this decision is a personal choice because every patient needs to find a doctor that they're comfortable working with. Breast cancer is a diagnosis that gets treated intensely because we take it very seriously and oftentimes requires long-term follow-up. So likely you'll be seeing your surgical and your medical oncologist and your radiation oncologist for many years and multiple visits. So you want to make sure you're comfortable with them. But then how do you know that you're comfortable with them without ever having seen them? So a lot of patients rely on word of mouth, and because breast cancer is very common, you likely know someone who's had breast cancer and who's had seen physicians on this. Online reviews can be helpful as well. However, sometimes they can be also misleading. So be aware that you never know who writes these reviews and why, and some of them can be not applicable or actually accidentally sent to the wrong physician. Search functions on websites of hospital systems can help. You can see who the system offers, who the doctors are, and you can also call them and see how quickly you can be seen because you don't want to not get an appointment with a physician that you like. You want to make sure that you're being seen in time so that your treatment can be initiated. But ultimately, you want to meet a physician that you like and that you feel comfortable with. If you don't like the person or if you're not sure, you can always get a second opinion. And that's really common. And in fact, we encourage it in a lot of our patients because we want to make sure that everyone gets the best care that they deserve and that everyone is comfortable with their treatment team. So that's important. If you're not sure, you can get a second opinion. When should you do a breast self-exam? I usually recommend to do it whenever you think of it. Your breasts may change throughout your life. They may become less dense. They may become larger with pregnancy. They may be larger with breastfeeding. They then may become smaller after pregnancy and breastfeeding. They may change with menopause. They may change during your cycle. So it's important to know what your baseline exam is like. But if you only examine your breasts once a year, you might be surprised at how it changes. So it's a good idea to do this whenever you think of it, when you're in the shower and clean yourself, when you're in front of the mirror, when you're taking your bra off or putting it on. You don't need to do it 3 times a day, but whatever you are comfortable with, I think you should do. And then learn what is normal for your breasts. If you want to, you can examine yourself for the first time or often right before you get your annual examination with your primary care or your GYN. This way, if you find an area of concern, you can show them right away and say, do you think this is normal? Do you think this is anything to be concerned about? This can be helpful in patients who have really dense breasts or breast tissue that's natural, a little bit more bumpy. So patients who have a cancer diagnosis and are waiting to meet with their oncologist always want to know what happens during this first appointment. And usually these first appointments are with a breast surgery specialist such as myself or with a medical oncologist. And usually these doctors will meet with you and go over your personal and your family history, and then they will examine you, and they will especially focus on both breasts and all of the lymph nodes surrounding the breasts. Those are the lymph nodes of the neck, of the clavicle area, and of the armpits. They will then explain the diagnosis to you, they will explain the pathology, and they give you an overview of the treatment options and the multidisciplinary nature of treatment because there's a lot of different providers involved. Ideally, they will review with you what these other physicians will do and which role they will play in your treatment plan and when you will meet them. So the first and most important part is to talk about the pathology so that you understand which kind of cancer you have, because not every breast cancer is the same. Grade is a thing that a lot of people confuse with stage, but grade in breast cancer does not mean stage. Grade means how aggressive do the cells look under the microscope? How quickly do they multiply? How changed are they? A cancer can be an early stage and a high grade, and it can be an early grade and a high stage. They will then review if your breast cancer comes from the breast ducts that transport the milk or the breast lobes that make the milk. And they will talk about receptors. Receptors are little proteins that stick on the surface of the cell, and they can give us information about how your cancer grows and what feeds it. The ones we check most commonly are for estrogen and progesterone, which are female hormones, and another protein called HER2, for which we also have targeted and individualized treatment therapy options. They will talk to you about the surgical treatment options, and those most commonly come down to lumpectomy or mastectomy. Lumpectomy is also called partial mastectomy or breast conservation. It means the removal of the cancer from the breast with a healthy rim of tissue around it. And mastectomy means the complete removal of the breast. They will also review whether or not lymph node surgery is needed to see if the cancer has traveled to the lymph nodes of the armpit. This is usually done with a sentinel lymph node biopsy, where they look at only a few lymph nodes. If there's a lot of cancer in the armpit already, an axillary node dissection may be needed. Sometimes no lymph node assessment is necessary. A plastic surgeon can help patients who are thinking about reconstruction after mastectomy, and every patient has a right to reconstruction if they have breast cancer. But they can also sometimes help for an oncoplastic consultation, where the breast gets preserved, but there may be a different consideration, such as a breast reduction that a patient may always have wanted, or such as tissue rearrangement because the tumor is in a cosmetically challenging location. Medical therapy is provided by a medical oncologist, and interestingly, sometimes medical therapy might come first. Medical therapy can be chemotherapy or targeted therapy or immunotherapy, and endocrine therapy, which targets the female hormones and stops the cancers from being fed by estrogen and progesterone. If they come first, they usually shrink the tumors. If they come second, the main goal is to prevent the cancer cells from spreading. Radiation therapy classically happens last, and that is delivering a high dose of radiation to the breast or the chest wall after a mastectomy, preventing the cancer from locally recurring in that area. And then last but not least, there is genetic counseling. A genetic counselor will assess your family risk, look at the type of breast cancer that is there, and then determine whether or not you would benefit from genetic testing. Sometimes we start with that, especially if a patient might be at a very high lifetime risk of getting a second cancer or cancer in the other breast, and if that would affect their treatment making decision. Sometimes it also affects the medications that a medical oncology might use, so it's an important piece of information to have when it's necessary. How quickly do patients need to make a decision about their breast cancer treatment? So we always want to make these decisions as quickly as possible, but we do want to have all the information that is necessary to make a decision. There's usually time to get more studies if they are helpful to make a decision, such as genetic testing. Maybe additional imaging is needed, such as an MRI, or patients aren't sure about what they would prefer and what they would want, and then can be helpful to consult with, say, a radiation oncologist or a medical oncologist. Ideally, with like any kind of treatment, be it medical therapy or surgical therapy, starting within a month. Sometimes it takes a little longer. Sometimes it happens much quicker, but that is usually the goal that we have. So if you think that you might need genetic testing initially or an MRI, there's plenty of time to get those test results back. And this is also a great question, asking which stage of breast cancer requires a mastectomy. And the answer, once again, depends. It depends on the size of the lesion, more so than the stage. And the stage is not always dependent on the size of the lesion as much, because some really big breast cancers behave not that aggressively, and so therefore they might be an earlier stage than a smaller cancer that behaves aggressively. So if a lesion is very big and invades most of the breast, a mastectomy may be necessary. It also depends on the size of the breast a little bit. Someone who has a very large breast might be able to preserve the breast even with a larger tumor because there is enough healthy breast tissue around it, whereas someone with a very small breast might not be able to. It also depends on the personal risk for a second breast cancer. There are patients with genetic mutations that place them at very high risk for breast cancer a second time or a third time on a recurrence. And in this case, a mastectomy might be recommended. Even stage 0 breast cancer, which is the non-invasive kind that sits in the breast cancer ducts, can require a mastectomy if it involves most of the breast or a really large area. There is one exception to the rule, which basically almost requires a mastectomy, and that is inflammatory cancer. This kind of breast cancer is very aggressive and it involves the breast skin. And once the skin gets involved, that means as much of the skin should be removed as possible. These cancer patients usually get chemotherapy first, but after that, the recommendation for surgery tends to be a mastectomy. So there are a lot of benign breast tumors that we see and that we find because mammogram is so good these days. And then a lot of patients that have a benign breast tumor wonder if these tumors can become malignant. So the answer is sometimes, actually very rarely, they can. Most benign tumors get monitored for that reason for a while to make sure they are stable and they don't change in their behavior. If they do change, if they grow rapidly, if they look different all of a sudden, they get excised. Specifically, there is one kind of benign breast cancer, breast tumor that's called a fibroadenoma. This is not a breast cancer, but can turn into one. A lot of people have fibroadenomas, and for most of them, they are there and they don't ever change. But sometimes they do change and they can grow and they can turn into rare breast cancers called phylloides tumors. When they do grow and when they do change, we recommend excision of these fibroadenomas. If they stay the same and if the biopsy has shown that they are benign, oftentimes we monitor them as long as the patient is comfortable with that. I think this is the last most commonly asked question, which says, can you be cancer-free after breast cancer treatment? And yes, you can be cancer-free. But it is important to know that breast cancer can come back even many years later. Most of them, if they do come back within 5 years. And our treatment has gotten so good that despite all of that, most patients survive 5 years, over 90%. The 10-year survival for breast cancer of all stages is 84%. So that is an excellent overall prognosis for a cancer. But we do want to prevent it from coming back. We especially want to prevent it from coming back anywhere else besides the breast. And that is why there's so many people working together to prevent that from happening. So these are all my slides for now, but I'll be happy to take any questions that you might have.
Thank you, Dr. Friedrich. That was great. Appreciate all that great information.
Of course.
We do. Terrific. Apparently, a lot of people are thinking the same things we are in Google search. Cindy does have a couple of questions to start us off. The first one is, does radiation treatment for breast cancer increase the risk for getting lung or skin cancer?
So that is a really good question. Radiation is a risk factor for cancer. And like I said before, radiation is a risk factor for breast cancer development as well if you had radiation before. Nowadays, radiation treatment gets administered in a way that they avoid all the other organs that don't need radiation. they tend to angle the radiation fields from the side so that the lung and the heart are spared and don't get a lot of radiation. There is a very rare cancer that can happen after radiation therapy called an angiosarcoma. Chances of that happening are about 1% after 30 years of breast cancer survivorship. So it's very, very rare, but it does happen occasionally, and that can occur. The radiation oncologist, when they meet with patients, recommend to do this treatment because the chances of preventing a recurrence or a second breast cancer in that breast are much higher than the chances of getting this rare kind of radiation-induced cancer. But they are nonetheless a risk and a complication, and they usually disclose that and discuss that with a patient to come to a good decision.
Thank you. The next question that Cindy has is, when a tumor is removed, can you tell when it first started growing?
No. We can sometimes estimate by looking at things like grade and the receptor profile that it grew quickly or that it grew slowly, but we can't for sure say this started growing in February or this started growing last year.
Thank you. I don't see any more questions in the Q&A box, but we'll just give everyone a minute if they have any questions that they can type them. It should be to the right of your screen. And I'll mention now that we have a minute that we continue our series next week with Dr. Mason, 9 things you should know about your breasts. And then on Thursday with Dr. Casaban, timing is everything for mammograms. Well, Jamie would like you to know that it was a great presentation, and she says thank you. And it was a great presentation.
Oh, my pleasure.
Oh, there's one more. I'm sorry. Joyce has a question. Are some cancers as ILC harder to detect? I hope I'm saying that right. Okay.
So Joyce is referring to a type of cancer called invasive lobular carcinoma. So I mentioned briefly before that most breast cancer comes either from the ducts that transport milk or the lobes that make milk. And so the lobes are the less common starting point for a breast cancer, but when they happen and when they cause an invasive lobular carcinoma, those can be harder to detect. Lobular breast cancers are known to hide from mammography a little bit more than the ductal ones, and so it can be difficult to estimate the true size, and oftentimes we think they are smaller when in fact they are larger, which is why a lot of patients with that kind of breast cancer will end up getting MRI treatment MRI diagnostics to help estimate the true size of these lobular cancers.
Excellent, thank you. Cindy wanted to let you know, thank you, and that this has been very helpful. She wanted to thank you for that.
Sure.
I think we're at the end of our questions. I don't see any more, but I would like to thank very much, Dr. Friedrich, for your expertise and your great presentation and for your work with women and breast cancer.
Of course, my pleasure. Thank you everyone for joining me tonight.